Well, just listening, I want to speak directly to members of the House because we've got a few minutes left tonight and some debate tomorrow. And, how does this play out over the course of the next few months? And by listening to what you gentlemen have just got done saying of Medicare, the significant improvements of strengthening Medicare, we're going to have to run an election. And there's probably going to be an election on this bill. And what's happened over the last few months is our friends on the other side have consistently tried to throw arguments against the wall, and they would just fall. They wouldn't stick because they weren't true. We started with death panels and illegal immigrants, and we went in abortion, and we went right down the line, and none of them ended up working out. It's going to bankrupt the country, and then we get CBO. I mean, you just go right down the line. They said it's going to support abortion, and then we have 60,000 Catholic nuns, 600 Catholic hospitals, 1,400 Catholic nursing homes, a bunch of Catholic theologians saying this is not a pro-abortion bill, this is a pro-life bill. Same thing with illegal immigrants. Then they say it's going to spend a ton of money, and then the Congressional Budget Office, a neutral third party, says it's going to save $1.2 trillion, reduce the deficit by $1.2 trillion in the second 10 years, $130 billion in the first decade. That's a reduction in the budget deficits on the backs of what the President Clinton did by reducing the budget deficit. So we have a history of doing that. So quickly, the debate in the fall about health care is going to go something like this. We pushed an initiative that is going to close the donut hole and give our seniors $250 just this year to help close that donut hole. Our friends on the other side running against us will be saying, we want to repeal that. We don't want that closing of the donut hole. We're going to be campaigning on little kids who have a sickness are now being denied insurance coverage because they have a pre-existing condition. We're going to say we stop that from happening in the United States of America. Our friends on the other side are going to be running a campaign saying we want to repeal that. We're going to have in there, we want to have a ban on pre-existing condition for all citizens across the board. Our friends on the other side are going to be running a campaign saying we want to repeal that. And on and on and on. People who are now getting kicked off the rolls, their insurance rolls, because they got sick. We're saying that could never happen again in the United States of America. And next fall, our friends on the other side of the aisle are going to say, no, we want to repeal that ban. We want to continue that practice of the insurance industry being able to kick people off of their insurance because they got sick. We're going to be saying, hey, your kid that just went on the insurance rolls because they were 24 years old, and we allowed that to happen because of the health care reform bill. Our friends on the other side are going to be saying they want to repeal that provision that allows young people to stay on their parents' insurance until they're 26 years old. Very clear. The family in my district, your district in New York, your district in California, your district in California, all across the country, those families of four making $50,000 a year who are going to get a $5,800 tax cut that we put in because of this reform, our friends on the other side are going to say, we want to run this election about repealing that tax cut. Same with the 50% or 35% and an up to 50% tax cut for small businesses. Our friends on the other side are going to say, we want to repeal that. This is a referendum on health care reform. I say I want to have that debate day and night for the next 6 or 7 months because that is a debate, Mr. Speaker, we can win and we shall win. And the issues in this, the only issue now is a lot of people do not know all of these benefits that have been itemized here tonight. They will know in the next 6 months. And I yield back to my friend.